University in Brazil. This is my... Hello, I'm Patricia Tavares. I'm a master's student degree at the 9th of July University in Brazil. This is my research project, which is about the effect of photobiomodulation therapy on the reduction of the inflammatory process and pain control in an experimental model of induced rheumatoid arthritis. My advisor is Rodrigo Labat. The involvement of rheumatoid arthritis is reached about 0.5 to 1% of the global population. But if the population between 55 to 75 years old is considered, this value increased to 4.5%. This is predominant in women between 30 to 50 years old, and this increase in the fifth decade of life due to the decrease in estrogen, deficiency of vitamin D, and calcium fixation in the bones as a result of menopause. Arthritis starts in a joint, usually in the ends, and progressively for several joints. It is an autoimmune disease. It's poorly understood and characterized by relapsing chronic inflammation that leads to destruction of cartilage from bones. Here, in this picture, we can see a rheumatoid arthritis evolution. In number 1, we can see a healthy joint. In number 2, a synovitis. Synovitis is a thickened inflammation of the synovial membrane, which begins to erode bones and cartilage. In number 3, we can see the panel. Panel is extensive loss of cartilage and thickening of the bones. In number 4, there is the invasion of fibrous tissue. In number 5, it's a bone ankylosis. The bones themselves fuse together. The articular cartilage is a unique anatomic structure. It is avascular and well organized. It has limited regeneration and always has movement functions. But with the progress of the rheumatoid arthritis, as we see in the picture above, this function is impaired. So, in these 3 pictures, we can see the difference between them. This is the normal joint. In the normal joint, you see a synovial space with liquids, the synovial membrane, good bones, and this is a good joint. In early rheumatoid arthritis, you can see the reduction of the joint space, the cartilage wear, and the liquid increase, growth of the synovial membrane, and the formation of the cyst and bone aerasions. In advanced rheumatoid arthritis, is a chronic inflammation of the synovial membrane, disease synovitis, alteration of bones, rupture of ligaments, large loss of cartilage with loose fragments, and major bone destruction. These are some triggers of rheumatoid arthritis. Genetic susceptibility, immunological factor can contribute for the occurrence of the disease. Hormone agents, for example, change in estrogen. Infectious disease, because they can interfere with the immune response and activate rheumatoid arthritis for those who already have arthritis. Oxidative stress, like cigarettes, free radicals, and etc. Environment and nutritional factor can contribute for the frame of rheumatoid arthritis. The symptoms are chronic pain, morning stiffness, edema of the joint, local temperature increase, disturbed by sun, fatigue, musculoskeletal damage, because cartilage inflammation can often migrate to the tendon and also to the bones. Pain is subjective and accumulative. The pain valence includes several concepts and methods which involve the investigation of a painful experience. Several aspects are involved, like biological, structural and functional, emotional, cognitive, and personal behavior. The most of the treatments are pharmacologicals. antipyretics, analgesics for inhibition of the COX-NPG, adjunct analgesic, antidepressive, anticonvulsivant, opioids, non-steroid anti-inflammatories, glucocorticoids. But the big question is, rheumatoid arthritis is a chronic disease, so the chance of you experiencing adverse effects is high. You may end up having a problem of dependence or tolerance and have to increase the dose. And you also have the photobiomodulation. With photobiomodulation, we have no risk of dependence and overdose. Photobiomodulation promotes analgesic and anti-inflammatory actions, biostimulation, regeneration, collagen synthesis, increased local microcirculation, absence of side effects. Photobiomodulation is a safe treatment. The justification for this work is the current panorama of rheumatoid arthritis, where the conservative treatment medication doesn't act in the clinical remission of the disease, doesn't present completely satisfactory results, has a high cost, and still produce undesirable adverse effects. Photobiomodulation therapy would be a non-invasive, without side effects, and presents positive effects reported in the literature on inflammatory cytokines in different types of tissue and experimental models obtained using low-intensity laser. My hypothesis is photobiomodulation therapy controls the inflammatory process in the induced of rheumatoid arthritis model, with a positive effect of pain reduction and cartilage protection. The general objective of this work is to evaluate the effects of photobiomodulation on the control of the inflammatory process and pain in an experimental model of rheumatoid arthritis. This is the methodology of the projects, the rheumatoid arthritis induction, the experimental groups, the analysis, the timeline, and the animal experimentation. We use the animal checklist. It's already known about the induction of rheumatoid arthritis using type 2 collagen applied to the fat adjuvant, and so it will be carried out in this way. Type 2 collagen is going to be used at the dose of 4 milligrams per milliliters, dissolved at acetic acid 0.05 overnight, full adjuvant, and each rat is going to be immunized by 3 injections of type 2 collagen. It will be 3 times of injections. Time 1 in day 1, time 2 in day 7, time 3 in day 21. In time 1 and time 2, intrademical inductions give the base to the tail from behind. In the time 3, induction is local in the knee joint. At the same day, the photobiomodulation treatment is beginning, and in day 35, the euthanasia and the analysis. Our flow chart. We are going to use 1 year old male Minster rats, weighing approximately 400 to 500 grams. The experimental groups will have N of 7, divided in control group and rheumatoid arthritis. The rheumatoid arthritis will be subdivided in non-treated and treated. Treated will be subdivided in local photobiome and vascular photosystem effect. All groups will have N of 7. This is our timeline of photobiomodulation application in alternate days. In both types of radiation, we are going to use the light emitter diode laser with the wavelength 808 nanometers, power of 100 milliwatts, and emission mode in continuum. In the local radiation, we use 6 joules energy per point, a single point of application, with exposure time 60 seconds. In the vascular radiation, the energy per point will be 180 joules. The point of vasculation application will be in contact, exposure time de 1800 seconds. Our histologic analysis will be tissue organization and inflammatory infiltrates Our functional test will be mechanical allodynia that will be performed 1 a week, and mechanical compression properties of the cartilage. Our biochemical and molecular will be a RT-PCR, inflammatory mediation, and joint degradation, IL-1, IL-6, IL-10, TNF-alpha, MMPS, receptors involving the pain, derokinin NK, bradykinin B, cortisol more, opioid, and GABA. Our statistic will be used means and standard deviation of the mean, ANOVA one way with Turkish post hoc. Thank you very much.